in terms of different types of stomas, I like to bring up. So brooking is the process of basically where you bring up that loop of bowel and then you flip it onto itself. So that's called brooking. And it's essentially when you take the intestines, you bring it out, you flip it back onto itself, and then you sew it. And so you have that little bud sticking out. Then you have an end ileostomy where they just kind of bring up one section of that bowel and it's just a single tube. Or you have a loop ostomy, which is pretty common, particularly for temporary ostomies. The loop is when you actually bring up a whole loop of your bowel and then you would create an opening in that. Oftentimes you might see something like a rod in there as well. So again, this is just some images to show you. So they would open up the efferent edge and the afferent side. And then they create this stoma outside of it. And you can see there's this little tube that is in the middle there. And that is help holding up that loop of bowel while the sutures are healing just to help decrease some of the tension.